Thatcher was born in Marine City, Michigan in 1905. So you see, he's only 84 or 85 years old. He's just a kid for this afternoon's program. He attended the business college there in Michigan and received a BA degree in business administration. And he's been a businessman most of his life, but what we're interested in is his work with Dr. Koch and the Koch treatment. If you are not familiar with it already through the book or books that have been printed, Dr. Koch and his work and his substance, glyoxylide, and what Larry will talk to you about, was successfully putting cancer into what we could call permanent remission, since you were not supposed to use that word cure around any place, but he was doing that 50 years ago. Larry worked with him probably longer than any man or lady now around. He organized a business called Koch Cattle Shots Incorporated, which produced and distributed cattle or products for bovine mastitis and dairy cow infertility, and thousands of these doses were administered in the 15 years that he distributed them, and with almost 100% recovery in cattle. In I don't know what year, but he was one of the 3 incorporators of the Christian Medical Research League, which produced and distributed the Koch products, glyoxylide and parabenzoquinone, something like that. He'll tell you how to pronounce it. And for 11 years, until pressure from the AMA and the FDA forced a returning of the license to the Koch family. He has spoken rarely on the subject, and we are privileged to have him here. He did speak in July of 1988 at the 16th Annual Cancer Convention in the Ambassador Hotel in Los Angeles, California, where he was given the Cancer Control Society Humanitarian Award. I feel that we're privileged to have with us today Larry Thatcher to talk about the Koch remedies. He lives here in Florida now, and we're happy that he's with us. Thank you for welcoming Larry Koch, Larry Thatcher, with us today.
Well, I think I'm the one that's privileged. I've had a wonderful time here in the last few days, and I certainly have learned much. I wish I could carry it all home with me and make use of it. I'm going to try to give you a statement about Dr. Koch and his life, his experiences in development of glyoxylide, which is the main product and the one that he had patented all over the world, pretty much, and a second product called parabenzoquinone. I'd like to say this. My experience started really back when I was about 15 years of age, and I saw a couple people, families really, that had cancer, the devastation of cancer, and being brought up in a home where prayer was daily occurrence. I just said, well, Lord, if there's ever an opportunity I can do something about cancer, I would appreciate the opportunity. It was sort of an empty prayer, I think, because I never expected to get into anything, really. But in 1944, I was reading about the doctors and his brother were in court. The Federal Food and Drug had taken them in, said there's no such product as glyoxylide, no such chemistry, and it has no value and this type of thing. And I read this in the paper, and I was trying to make up my mind what's going on. I guess I was about as ignorant about what the government was doing and had been doing. I thought they were supposed to do what was right, but I found out a few things about it. Anyway, just a year later, my sister-in-law developed cancer of the lymph glands. She was literally filled with tumor growth. And the day she was told, she had had a biopsy, and she'd been really 4 or 5 months in the development of this. And when the surgeon finally gave her the bad news, he said, you've got about a month of life expectancy. And we have nothing for this particular problem. Everybody that has it dies within 3 to 6 months. Well, she found out that particular day that Dr. Willard Dow, president of the Dow Chemical Company, had had a contact with Dr. Koch. They'd had a problem in the production of plastics. Plastics were gelling in their equipment. They had to tear it out and put in new. And so they put them in the library, and they found that Dr. Koch was actually using the free radical in chemistry in the treatment of disease, and that the free radical was their problem, and they didn't know how to handle it. And so they got in touch with Koch, and Koch straightened out their problem, and it brought these two men together. And then Dr. Dow said, I would like to help you produce some additional products. He said, we have thought for a number of years that product of high oxidizing characteristics should be the approach in the treatment of many diseases, especially with us here where we lose so many man-hours to common cold and influenza. So that developed a situation where he asked Dr. Koch to come up into the Midland area in Michigan and treat people. He would provide those that had need, and he would keep a record, and eventually he had hoped to help develop other things. Well, that didn't develop because Dr. Dow was killed a couple of years later in an airplane crash, and it didn't move along that way. But I want to just say this. I called Dr. Koch after my sister-in-law had taken this one injection of this product, and in a week's time, the tumors across the back of the neck were gone. They just disappeared rather quickly. They were small, about like a hickory nut, under the armpits like bunches of grapes, and they disappeared in about a week, or rather a month, I should say. And at the same time, she had additional tumors in the groin, and it took about 2 months for those to disappear, and another tumor in the left side of the abdominal area, and that was entirely absorbed within 3 months. Now, in a month's time, she had energy that she hadn't had in months. She had more energy, really, than any member of our family. A rather unusual thing happened, and that was that the doctor said, if you're 39, and if you don't want further children, it'd be well for you to take proper precaution. Well, she had told the doctor she'd had surgery 16 years before. She had had no children, so she didn't think that was possible. Well, he said, you better give it some thought, because this is going to energize every organ in your body to function better and differently. And anyway, a month later, she was pregnant. Well, I'm going to leave that for the moment, and I'll go back to Dr. Koch. He was born in 1885. He entered I don't really know his background from 45 to 1910, but in 1910 he entered the University of Michigan to, I guess, work to get a better education in chemistry. And there were a number of things that happened while he was there. He taught, incidentally, histology and embryology all during the period he was there, and he was there until 1918, as I recall, so that's quite a long period. He was awarded several degrees, including his PhD, but he had contact with Dr. Gomberg. Gomberg was researching the free radical. Free radical at that time, as I recall, was not really an accepted fact. So Gomberg was doing the research or whatever was required to bring it into actual recognition. And Dr. Koch was working with Gomberg, and of course he had the advantage of learning all the evidence that Gomberg was learning, and it worked to his advantage. A little later, well, during this time, he also attended the Detroit College of Medicine. He got his medical degree there. He even taught I don't recall what he was teaching there, but he did get his degree there during that period of time. And somehow he began to feel that oxygen was the primary thing that he wanted to work into, that it was basic in the development of a lack of oxygen is what I should say, anoxia, was a factor, maybe the primary factor in the development of all disease. And so about the time that he, or just a little while before he graduated, he began to think about what organs were least affected by disease, or the longest. And he came to the conclusion that the heart and the brain seemed to be those organs. And so when he got into the practice of medicine, and maybe just a little before that, he, it was after he got into the practice of medicine, he asked a couple of his students if he could treat, they were in practice, of course, if he could treat a couple of two or three terminal cancer patients. And so he was given 3 women who were terminal and figured 10 days, 2 weeks life expectancy. And he had taken beef heart and beef brain. He had ground it up and purified it and injected a couple of cc's, about 30 drops of that, into each of those 3 people. He followed them up, but except for the one woman, he said a week after he had treated the 3, the one disappeared. He didn't see her, find her, and he assumed that she had passed away. But the other 2 continued to develop and improve, and were totally free of cancer. I don't recall the time. That doesn't matter that much. But to complete that story, a few months later, he met a lady, stopped him on the street in Detroit and said, "Dr. Koch, you saved my life." And so she related that she was one of the 3 that had taken this treatment. So that encouraged him to go ahead and try to work out some products in chemistry that could be made up. And so he started with, I would say, inositol, reaction products of inositol and ethyl alcohol, and sulfuric acid, and some of these products of high oxidizing characteristics, put them together in a homeopathic solution, 1 part to 1,000,000 and 1 part to 1,000,000,000 and then on up. And of course that was the beginning, and I know that through the years he did make some changes, probably not great at the time, but even in the late years of his life, he reported to me that in a letter that he had now perfected a product that he had used early in Detroit. Now, I didn't say this, but he was in practice in Detroit, had a clinic there as well as having a laboratory. From 1918 on up, he tried to present his work to the medical profession 2 or 3 times in those first 2 or 3 years. And when they saw what he had, they just simply said no. They just wouldn't give him an opportunity to speak to their group or to inform them as to what he was doing. But he continued to make an effort to do something of this nature. But I'm just trying to put this together. I didn't make a record of what I wanted to say. But in 1943, the federal government had an injunction against him and had him into court. He went through a 5-month-long trial. In which they said, of course, he had no such product and all this. But they were unable to prove anything. Actually, they were doing everything they could to get a jury to believe their case, but it finally ended in a mistrial. And it was the next year after that when my sister-in-law had this problem, and I saw the recovery and had an opportunity to visit with Dr. Dow of the Dow Chemical Company, and in fact, I wrote him a letter, and he wrote a 3-page letter back, told me just what he was doing and what his interests were, and so forth. But in 1945, after her recovery, I called Dr. Koch and I spoke to him. I said, I would like, is there any possibility that I might be helpful in some way? And he said, yes, I would like very much to talk with you. So I said, well, I'm going to pick up my daughter in Ann Arbor Friday, and we'll come back through Detroit, and we'll stop and visit. And then he told me, he said, the thing that I need is public relations. He said, the government doesn't really understand what I've got, and if they knew, if we could get the information to them, he had enough people telling them they want this type of medication, possibly they would do something about getting the Federal Food and Drug off my back and let me work. Well, he said, if you can think of anything that might be helpful, that'd be fine. So I went home, and just about a week after that, I got a bulletin that was issued by the Department of Agriculture in the province of British Columbia. And it seems that Dr. Arnott, who was a general practitioner in London, Ontario, Canada, had learned about the Koch products, and he had gone over to Dr. Koch and had learned about the products and went back and began to use them. And he became a producer and a distributor user of the product for 17 years. And he had a man drop into the office one day that had undulant fever. And he'd had it for some time, and he'd been around trying to get some help, and it just wasn't getting the help. And so the doctor gave this man one injection of glyoxolide, and within a week, the fever was apparently taken care of. And Arnott said, well, that's something that our dairymen are having problems with Bang's disease, and there's other names for it, of course, and that's what the dairymen call it, and that's contagious abortion. And so he got one of the veterinarians in the area to work with him, and they began to treat animals with the various diseases. Now, this is the first time that even been given any thought to what it might do for animals, at least the larger animals. Possibly in the smaller animals, they may have been doing some research. But it wasn't too long until the information that they had published moved around into Canada, and somewhere up in Saskatchewan, they asked for some of the material and began to use it, and the product was so successful in the treatment of these animal diseases that the Department of Agriculture in the British Columbia and the University of British Columbia, they began to think about it, and the head of the Department of Agriculture called Dr. Arnott and said, will you come up here and tell us what it's all about? And so he studied it, and he said, well, it looks like it's a new approach to the treatment of disease, and I think I'll call a group of people together that are interested in the animal work, and we'll see what we can do. And so they started a project there by the two organizations, the Department of Agriculture and the University of British Columbia, and they did 5 years of official work in determining the values of the product in animal treatment of animal diseases, and it was all favorable. They put out, I think, 3 different bulletins in 30, 40, 344, and 145, 46, and again, one in 49, a final statement. Well, the bulletin that I got was the first one, and so I called Koch and I said, well, I'm sitting here in Albuquerque County in Michigan. We have the largest dairy population of any county in the state, and it looks to me like we could organize something similar to what's going on up in British Columbia. And in that way, we could have all the farmers in Michigan pretty much alive and knowing what's happening. And so he gave me the okay to go ahead. He said, I'd like to do it. I'll give you whatever cooperation you need. If you need a couple of veterinarians, fine. If you need product, I'll give you all the product you can use. And so we started in that, and I had number of farmers I knew. So I didn't know anything about a farm. I'd never been on a farm. I only walk in and walk out. And dairy cattle were new to me also. But anyway, some of my friends treated a few animals, and we were very successful in the treatment of mastitis and infertility and some of these other problems. And from then on, of course, I had being in the community so long, I had the cooperation of the Rotary Club, the Chamber of Commerce, and the newspaper, and all of that. So it was no problem to get the work started and to get lots of people knowing about the work. And within a few months, we had Dr. Arnott come over and speak to a group. About 300 people showed up, and they were largely farmers, of course, but we had professional people in, and numbers of people from the college, Michigan State College, and also some practicing physicians, and some of the people from Dow Chemical Company. And that's, during that meeting, they just decided they'd like to have a committee go and talk to the people at Michigan State College, the veterinary college, and see if we could get some activity from them. Well, we tried it. To make it a long story short, they just backed off. They said they'd like to do this and they'd like to do that, and we wanted them to do some work in mastitis, and they said yes, they could do it, but it would take quite a long time, and they just didn't have the money. So I went to the legislature, and we got the promise of whatever money they wanted, whether it was $20,000 or $40,000, they were willing to do it. And they sent a man out with our committee to tell the head of the veterinary department that they would spend the money they'd like to. And then he said, well, I don't have the staff to do it. And Dr. Arnott was with us at this particular meeting, and Dr. Arnott said, well, let's talk about the sugar problem, astonemia or ketosis in animals. He said, we can take an animal, and you get the urine, and you put the urine on a little tablet, and if it changes color, it's positive, and if it's negative, it doesn't make a change, or however it was. And you can give the animal treatment, and in 4 days, it should be perfectly well. And you give it the second test, and you see it's negative, well, then you've got the answer. All we really want to do is really show that the product has activity. Well, the answer we got from Dean Bryan was, sorry, I don't have an expert can do it. Well, that told us the story that they were definitely not going to do anything. And it wasn't too long after that, at one time, he called and said, I would like to have a couple of ampules, and I'd like to treat mastitis and see what the product really will do. Now, he could see with two treatments, but he had told us before it would take a couple of thousand to really make any headway and show us anything worthwhile. But he treated the two animals, and the next thing I knew, I had a man rapping at my door Sunday morning, and he said, I'm the editor or the Detroit Free Press, a medical editor, and I've got a statement from Michigan State College. They've used their product to treat mastitis, and he showed me the article, and of course it was negative. And he wanted to know if I would like to make a statement in opposition to whatever was being done. Well, I did make a statement, but I wasn't really qualified to do what should have been done, but it wouldn't have made any great difference one way or the other. But I want to get back to Dr. Koch in his work with Dr. Well, anyway, the gentleman that was working on the free radical, he learned, of course, how to handle the free radical, and then when he became got into the medical field, why he got these products of beef heart and beef brain, and then began to inject these ladies, and he got a recovery there, and then he began to try to add to the chemistry of natural immunity And his work started in about 1918. He had a clinic in Detroit. The product was on the market for by 30 years, and there were, I would say, 4,000 to 5,000 medical doctors and osteopaths throughout the state using the product for the treatment not only of cancer but of every other disease. Now, basically, as I understand it, Koch said he felt that oxygen within the bloodstream, within the cell, in the cell grana, or the energy-producing element of the cell, was basic if you were going to recover from disease. And if you had a lack of oxygen there and a lack of good nutrition, you were subject to any type of disease that could happen. Anyway, through the years, there were a lot of things that happened that I had occasion to see. Now, as someone had said, in the treatment of all these animals, I saw thousands of animals that were treated, and we had this one project that ran for 13 months. We were treating mastitis primarily with scar tissue of the udder. These udders would get just as hard as a tabletop. Some of them, one quarter, 2 quarters, 3, 4, the whole thing. And of course, the animal was doomed under normal conditions to be slaughtered. There was no way, there was no treatment available that would do anything worthwhile. But we found that, or rather they found in British Columbia, that they could give 1 injection of the glyoxylide, and within a week or so, the hard tissue began to break down, and they could milk it out in strings and small bunches, and within 30 days, sometimes a little longer, the udder would be totally free of any of the scar tissue. And when that animal freshened, then it would be perfect insofar as the udder was concerned, and the production of milk, even a higher quality milk, and all of this was the result. And that, of course, was being published up there, and we had the same results in Michigan. We did set up a project that ran for, I think it was 13 months. During that period of time, Dr. Dow had called me and said, I want to help you with this project. I'll set aside $5,000 to do the laboratory work, and I'll give you a field secretary, a recording secretary, and all this work now is recorded there at the Dow Chemical Company office. And so we did this project, and Koch went through these two trials. The first trial ended in a mistrial. The second one came 3 years later, and they went for 5 months again, and the same result. Actually, they said a juror had become ill, and they dismissed the situation, but there was quite a little evidence that somebody got to one of the jurors, and the illness was possibly an instigation of the opposition. But anyway, they didn't want the Dr. Koch to be exonerated, and they just let it as it was. Well, in 1948, Dr. Koch knew that they were endeavoring to get another trial, and so he. But in August of '48, the federal government withdrew their charges, and that he had been under indictment, so he could not leave the country. Now, he'd been doing research all over the world, many countries of the world, maybe I should put it that way, and so they just didn't want him doing research in other countries. And he simply said, well, I'm not going to stay here and be a target for that sort of a situation again. I'm just going to close up my laboratory, I'll lease my clinic, and I'm going to move to Brazil. Now, he'd had a situation where he had been going to Brazil, and they had no ship doctor, and they said the boat could not leave until they had a ship's doctor, and they asked for, if there was a doctor on the ship, if he would report to the captain. And anyway, he took over, And there was a high official from the Brazilian government that was there, was seriously ill, almost at the point of death. And he took over the treatment of this man. And by the time they got to Brazil, he was doing very well. He made a complete recovery. And so Koch had a helper in the government in Brazil. Everything was wide open to him down there. Whatever he wanted to do, they were willing to cooperate and give him every break they could. And so he did a lot of research in Brazil, Argentina, and Germany, and various other places. He earlier had done quite a little work with another doctor in Belgium, and they went into the Belgian Congo and other places and treated various types of disease that never had been treated successfully before, with great success. Incidentally, I have a little booklet here, that publication that was made out by one of the publishers. I'm trying to think of the name of it here. Mead Lane was, and anyway, this gives a history of the work up through until about 1950. Well, Dr. Koch, when he left for Brazil, went down there and stayed the rest of his life. Two ministers of the gospel who had some, I don't know just what their background was with the Koch treatment, but they talked to Dr. Koch, called him and asked him about the possibility of setting up a corporation, a non-profit corporation called the Christian Medical Research League eventually. And so he said, yes, if you will produce the products legally and properly, yes, I'd be glad to let you have a license. But he said, I want one person whom I know, and we had worked together, and I'd been with Dr. Koch about almost every week for the period of between the time we started and about 4 years. He said, I like somebody in there that I know, and so whatever thing comes up, why, I'll have some confidence in talking to him. And so I became one of the incorporators, and we produced the product from December of 1948 through 1959, and we would have continued, except for the fact that when you see, our product was produced legally. It was protected by the grandfather clause because it was in use back in 19. Are you getting?
I hear you. Yeah, that's better.
Okay. He was. Let's see. No, I lose my. Yes. Well. Yes. We had that protection, so there was no problem insofar as our producing it. It was perfectly legal. But when Dr. Koch was under indictment, they had the organization had issued an injunction against saying the product had any value, and the injunction still stands. Incidentally, I understand there's a good possibility that we can contest that and get that objection removed, but it's still there at present time. So it makes it pretty difficult for doctors to use the product. Now, in many cases, not many cases, but in several cases, let's put it that way, doctors that were using the products were harassed to beat all. They would, the FDA, or not the FDA so much as the AMA, would talk to them about the use of the product and say, we can't use it and you should stop using it because it's giving us problems. And he'd say, well, let me show you the results I'm getting and look them over and see what's happening. And they'd say, no, we don't want to look them over. We just want you to stop using the product. And so if that didn't stop him, they would stop him from using the hospital facilities. And when that didn't slow him down, well, then they'd go to they'd take him into court on false charges and maybe have 10 or 12 charges and keep him in court for a period of time, maybe a year or so, and they'd drop it one charge at a time and then finally dismiss the whole thing. But that didn't stop it. They would go then to the licensing board and say, this man is using products that we can't use. It's not approved by the AMA. And so the patient can't get the proper treatment. And so some of the doctors lost their licenses. And that was the ultimate factor in the league's decision to turn the license back to the Koch family. Well, the Koch family were under indictment, or is under this injunction, I should say, and they, if they said that the product had value, excuse me, well then they would be in the courts again too. So they didn't want to get into it. Every one of them, every one of the Koch family were well-to-do. There was no problem financially. They didn't have any great desire to get back in and get into trouble. And so here was a period of time when there was nothing being produced. Excuse me. And I had all the formulas, and the man that we had sent to Brazil to be trained in the production of the chemical was a very dear friend of mine. And so I had a doctor call me and say, can you teach me how to make this product? I'd like to make it available. This one man had a cancer problem, and they said he was near death. And so I got him the product through a doctor that had been going down to Brazil and getting a suitcase full of the product and bringing it home. It wasn't being produced here. And anyway, this man was taught how to make the product, and he made it for 10 years. Unfortunately, he died about 10 years after that, and that left us in limbo again. And so then I contacted the chemist, whom I knew well, as I said, and said, I'd like to teach some of these people here how to make it. They're showing an interest in production distribution, and I know Dr. Koch would want it available. And at first he had said, well, I promised Dr. Koch never to reveal the information. But we talked to him about the fact that Dr. Koch had passed away, and it was his life's work, and it was his great desire to make this product available around the world, and it should not be held up. And so he thought about it for a little bit. About a week he called me and said, well, Larry, send the doctor up, I'll teach him. And so he taught this one man, and that started, well, actually there were two people. And then we taught two more, and then two more, and so we've got, at least 7 or 8 people now. A couple of them been trained by a second party, not the chemist that we had sent to Brazil, but by a second party. But we have tested the products, and we know that they are working and doing the job. And so the distribution is limited, but still quite a number of people are distributing and using it. I don't know how many doctors are using it, but quite a number, not only in this country, but in England and other countries. And one in Brazil just recently, who was a real close friend of Dr. Koch's, called and wanted some material. And so I think we'll have somebody producing the product in Brazil very, very shortly. And it was just I had the only opportunity, I guess, to do anything, it seemed. And a couple of years ago, I just said, Lord, if you want this to move, give me some help. And amazingly enough, right soon after the talk in California, the telephone began to ring, and it hasn't stopped ringing. It's been so much so, in fact, the day, I guess, before I came up here, it was from early morning until midnight. And when I got up here, I was ready to get a little rest, which I didn't get for a while. Till last night, I got a very good rest. But that's the situation. Now, I want to tell you about a couple of things. The treatment of viral conditions. How's the time? 12 minutes, good enough. In the treatment of viral conditions, we had annual meetings of the Christian Medical Research League, a number of them. And we had, of course, the doctors who were using the product speaking to the group. And they all said, when speaking about viral conditions, we have never treated a viral condition that we were not able to correct. We had almost total elimination of the viral condition, and in the acute stages in a matter of hours. If the condition was treated in a matter of 12 hours subsequent to its initial start, it would be pretty well over within the 12-hour period. If it was 24 hours, it would take about, or 2 days, it would take 2 days or 3 days. After the third day or so, it might take longer. It was a little more of a chronic situation, and then it was slower. But normally there is a program that is given to the patient if it's a long-term situation like cancer. They, like with my sister-in-law, they said, we want you to go on a fast for 3 days. We want you to cleanse the colonics and whatever. And after that, we want you to change your nutritional program, no animal protein whatsoever, and told a few things that they should avoid and what he felt was helpful in restoring immunity. And I have one case I want to relate, and that's an aunt I had of 80 years of age. She had been told that she was feeling bad, and I took her to what was her doctor, and he called me in and he said, your aunt has cancer, and there's nothing we can do for her really except to try to keep her comfortable in the last days, and she's going to have a lot of pain. Well, my sister-in-law had been treated successfully, and she knew about that. And so I didn't mention cancer to her. I didn't know whether she'd been told she had it or not, so I didn't want to disturb her. And but I did say, Cora, would you like to see Dr. Koch? And she said, yes, Larry, I would. So I made an appointment. Thank you. And we went to Detroit, and I said, Dr. Koch, just look her over and see what she needs. So he looked her over, and first thing he said was, Mrs. Secord, you do not have cancer. No cancer. But he said, I note that you have eczema. You've had it probably all your life. And she said, yes, ever since I was a girl. He said, that is a condition that started because of a viral condition. I don't know what the viral condition is, but whatever it is, this product will oxidize and burn off the protective tissue that protects the virus. It will open the virus up to oxygen, and the virus will die within 1 minute to 2 minutes. And that will end your problem. So she called me about 4 months later. He said it would take 3 to 4 months. And he said, you'll have a 8 to 12 hour acute condition, whatever it may be. So she called me and said, well, Larry, it's all over. And I said, okay, and Cora, tell me what it's all over. And she said, well, I had measles last night, or yesterday. They're gone today. Now, she lived to be 94, another 14 years, never again had eczema. So to me, that says a lot of things, because I was getting correspondence with Dr. Koch through the years. We were kept up a constant communication, and he was telling me that he had improved the product and that he was getting practically 100% recovery in every form of cancer, and that he was getting it in diabetes. And I got to thinking about that, and I thought, well, how does he get this in diabetes? That's a pretty hard thing to take care of, at least as a layman. I didn't know what really was happening. But with my aunt's situation and the release of the virus and the elimination of the virus, I thought, well, if the virus has penetrated the pancreas, that could be a factor. And I don't know any reason why it couldn't be. So if you get rid of the virus in the pancreas, and then the pancreas possibly can be restored to natural function. And I think that's what happened. But of course, I'm not in a position to say that's what happened, but I think so. But there were many other conditions such as that. I had a lot of experiences where people had terminal arthritis. And I've seen those situations cleared up in 90 days' time. I had one man that you had to pick him up and carry him and take him to the clinic. And the veterinarian who was heading up the work that we were doing in Michigan that night at 13 months, he was a friend of this farmer, and he picked him up and took him down to Detroit. He got the treatment. Now, in 3 months, he had no reaction whatsoever, no help. So he came back and he said, well, look, I know this works. I'm practically getting 100% recovery in animals, and I've got lots of animals that have the same sort of problem, arthritis. So he put him in the car and took him down again. The second time he got the treatment, in 3 months' time, he had absolutely no problem whatsoever. Now, he couldn't close his hands to put his key, couldn't hold a key. He couldn't walk. He had to be carried and put in the car. 3 months later, he went down to the old farmer's picnic and entered the older men's foot race. He beat them all. So you see some of these things, and I saw so many things. I could give you 100 illustrations, I guess, of different conditions that I have seen make a recovery. But when I saw what happened to the animals, they are not too difficult to handle. They're not quite like the human. You can control them. They have the same water and the same feed pretty much, and you know, if you overfeed them proteins, they're going to have problems. And so you just try to handle that in the period of the year when they're feeding more protein, and that's the winter time. But when they're out on the grass in the summertime, they hardly have a problem. It's practically nothing. But so I relate the two, and I see what happens to the animal, and practically 100%. So I know that if the person will handle their nutritional intake in their cleansing of the situation and take the treatment, they have a good chance of recovery. And I don't limit it, in my opinion, to any condition. And this paper right in here tells of many conditions that were never treated successfully before. Closer to the mic. Yeah, I get away on the side here. I'll try to read this. Well, I don't need it. Anyway, I've only got 4 or 5 minutes. Is there any question?
The use of oral rather than injection. Any comments?
It has been used the last 20 years primarily as an oral administration by individuals. Now, whether the doctors have been doing it this way is another question. But Koch felt that the syringe had to be cleansed properly, and it's unlikely that any of the doctors today are using glass syringe. They're probably using plastic, and so Dr. Koch would not approve a plastic syringe. So I personally have taken it orally, although I had a doctor in my house a couple of months ago, and he gave me an injection with a glass syringe. It was properly cleansed. But I don't know, will that answer your question?
Is it still made with animal products?
Repeat the question, would you, Larry?
Oh, what was the question again?
Is this formula still made with animal products?
Is the formula still made with animal products?
For animal products, but not.
No, not made from animal products.
No, it's never made from animal products. No, basically it's a homeopathic remedy, and anything that will cause a problem can be made up in the homeopathic dilution. Actually, it's made up of chemicals of high oxidizing characteristics.
Question over here.
Yeah, how
Well, it's called 2 cc's or about 30 drops. It doesn't really have to be that much. In years past, they used 1 cc or 15 drops, and it worked just well as far as I can see. And why they changed to 30 drops, I don't know.
Question here, Larry.
What are the side effects of receptor?
Well, that's a good question. There are no side effects from the standpoint of the side effects you get from a drug. But you have to realize that when nature begins to make a correction, whatever condition you may have had that's causing some of these serious effects will be temporarily brought into a mildly acute situation. And if you understand that and let it go through as nature meant, then you get a recovery.
Well,
Very
it
good.
acts homeopathically, right?
It acts homeopathically. If you're accustomed to homeopathy, you know what it's all about. That can answer most of your questions. Okay, guess that'll do it.